Hi, everyone. My name is Jessica. I am a post-lung transplant coordinator, and this presentation will go over post-lung transplant care. So in this presentation, we will go over who is part of the team, how to contact the team, scheduling issues, what we expect for you guys to do at home, potential complications that you can see after transplant, and a recipe for success. The outpatient team is multidisciplinary. There's made up of doctors, nurse practitioners, nurses, pharmacists, psychologists, social workers, nutritionists, medical assistants, administration, medical coordinators, and financial coordinators. We all work together to help your post-lung transplant be a success. Each patient is assigned a nurse practitioner, and a doctor, which makes up your panel. Contacting the team. So ways to contact your team. There are several ways that we can communicate. First is by the phone. So your nurse coordinator will have a direct line that you will have access to. We're available Monday through Friday, 8 to 4. And usually if you leave a voicemail, we do try to get back to you within 24 hours. And then you can also call the admins. They have also a direct line where you can call if you have any scheduling needs, any issues with testing or timing of appointments. They are the contacts for you. The nurses ourselves, we don't have access to the schedule, so call the admins for that. We also expect that if we reach out to you, that you are available, that you answer us or get back to us as soon as you can so that we can have open communication. There's also Patient Gateway. You can add this to your phone as an app, and then messages can be sent back and forth between you and the providers. Typically, you have to select a nurse practitioner or a doctor, and then it comes to the nursing pool so that we can respond to you. That we have up to 3 days to respond. And then lastly, if things are urgent, if it's a weekend, holiday, night, off hours, and there's something that urgently needs to be addressed, you can page the pulmonary transplant doctor. They're available 24/7. If you don't hear a response from them within an hour, page again. And then if you still don't have an answer and it's an emergency, please don't hesitate to call 911. Reasons to contact your nurse. We are here to help you. Anything that comes up, we want to know about it. So any change, any new symptoms, if you have a fever, if your spirometry is changing, if your vitals are changing, any changes in your breathing, bowel patterns, if you see a local doctor and they prescribe you a new medication, we want to know about it because it could interact with your transplant meds. Any illnesses, accidents, hospitalizations outside of the Brigham that we need to know about, or any new diagnosis. Anything at all, let us know. We want to be informed so that we can help you. Also, you can call with any questions. So if you get discharged and you're overwhelmed, you're confused, you're not sure what you need, call us. We can talk you through it. We can go over your medications. We can go over timing of appointments. We can go over labs that are needed, lifestyle changes, anything at all. And lastly, prescription requests. So we are your contact to refill prescriptions. We like you to give us a notice at least 2 weeks ahead of time before you're out, because a lot of times there are insurance issues or other problems that come up that take time. So you don't want to call us and say, hey, I'm out today, because it might take time before the prescription can get refilled. Also, a year post-transplant, we really do try to have your primary care doctor and other specialist doctors take over prescriptions that are not related to transplant. So be prepared for that. Clinic appointments. This is a very busy slide, but basically fresh transplant right out after discharge, we're going to be seeing you very frequently, up to weekly, for at least a month or two, just to keep getting labs, x-ray, spiro, being in close contact with you and helping you through the transition. After that, we start to spread things out. It could go to every other week, monthly. Eventually, most of our patients are typically seen every 3 months. And some of our patients that are really far out and stable get to come every 4 to 6 months. With your clinic visit, there are multiple things that you need to do that day. We get labs to check levels, we get a chest x-ray, and we get spirometry to check your lung function. We ask that you come to clinic at least an hour ahead of time before your appointment so that you can get this testing done before. The more information we have at your clinic visit, the better the visit and more productive it can be, and we don't have to reach out to you later to review things. But the most important thing is to not be late for your clinic appointment. If your clinic appointment is scheduled for 9 a.m. and you get there at 8:45 and you want to run to the lab, run to x-ray, run to spiro, you're going to be late for that 9 o'clock appointment. So we'd prefer that you skip the testing, come right to clinic at 9 o'clock, see the provider, and then you can get testing done after. If you had traffic and you're late, the providers might tell you that you can't be seen and that you have to wait until they're done with their clinic to be seen. This just helps the providers stay on time and keeps the patients that were on time seen at their appointment time. Also, with clinic appointments, we just want to be open and let you know that they could be longer than you anticipate. So if we see something concerning or we require additional testing, we expect that you stay for that. Sometimes you need IV medication, so you either have to go to the infusion room or the emergency department to get IV medication. And sometimes we have to admit you and you have to stay over. So be prepared for that. So bronchoscopies is next. These are done periodically throughout your transplant. They're more frequent, fresh post-op, and then only as needed after 1 year. So we do surveillance bronchs 1 month, 3 month, 6 month, and 12 month after transplant, and then as needed, like I said. So these are used, it's a special camera that goes down and takes a look at your airway. It lets us visualize and assess internally and collect samples for secretions. We look for viruses, bacterial infections, fungal infections, things like that. And then we're also able to get some biopsies to check for rejection. Like I said, if farther out from your transplant, we have reason that we need to go down and take a look or get samples, we'll schedule a bronchoscopy. Next is lab monitoring. Lab monitoring is very important. So for your immunosuppressant meds like tacrolimus or cyclosporin, we need accurate levels and frequent blood monitoring to make sure your dosing is appropriate. So we will ask you to go to the lab to get things done. When your appointments are spread out, we appreciate if you have a local lab to go to get these labs done. We prefer a Quest diagnostic site or an MGB site because the lab results and lab orders are directly in our system. But I know a lot of patients in Maine, that's not an option. So we will work with you and find a local lab that will be convenient. You must be flexible and ready to go to the lab whenever we're directed. A lot of times after clinic, we check your tacrolimus, we adjust your dosing, and then we ask you to repeat a week later. For these labs, they're timed. We want it to be a 12-hour or 24-hour trough. So whatever time you take your medication, the day or night before is the time that we expect you to be in the lab. So if you take your meds at 9 p.m., 9 a.m. is when you should be drawing the lab. You also should be holding your medication before you draw the lab so it's accurate. And we'll go over this with you in person before discharge, after discharge, in clinic, and we'll always remind you. Other things we're looking at in the labs are white count, kidney function, viral loads. So, be ready to go to the lab and be monitored. So we want you to be monitoring everything at home so that we can assess when anything changes right away. Vital signs, you should be checking your heart rate, blood pressure, temperature, oxygenation levels, any changes if your blood pressure is high or low, if your temperature, if you have a fever, or if your oxygenation levels start to change, we want to know about it so that we can act quickly. Home monitoring. So at home, we want you monitoring everything so that if there are slight changes, we know about it quickly and can act quickly. With transplants, things can turn quickly, so we want to be aware and be on top of it and act fast. So vital signs, heart rate, blood pressure, temperature, and oxygenation levels are important. We also want you to monitor your blood sugars. Usually post-op, after your transplant, if blood sugars are not an issue, we will tell you and you won't have to monitor them anymore. Other times it's long-term and you have to check them daily or more than daily. Daily weights are important. Weights can fluctuate and we want to make sure that you're not gaining weight too fast or losing weight too fast. And then spirometry. We typically have your daily journal where you can enter in all of these data points and bring your journal to your clinic appointments so that we can look over those numbers with you. So spirometry, there's two values that are important to look at, FEV1 and FVC. Forced expiratory volume and forced vital capacity. We strongly encourage you to get a spirometer when you're discharged home so that you can monitor them regularly at home and tell us if there's any changes. Changes in these numbers will be the first sign that something's wrong with your lung function, so we want to act fast. At discharge, we'll put in a referral to a company called Remetric Health that will give you a spirometer. Sometimes they don't contact the patient or sometimes the cost is too much. So please, if within 2 weeks after discharge, you don't hear from anyone, let us know. You can also buy them online. You just want to make sure they do the 2 measurements that we need. Next is the importance of having a local team. So we want you to keep in touch with your local providers. This will help us keep you out of Boston if we need additional testing or follow-up. So your primary care doctor will be in charge of your regular health maintenance. So checking your cholesterol, getting colonoscopies and bone density tests, mammograms, all of the non-transplant related health things need to be done through your primary care. There will also be referring you to specialists if you don't want to come into Boston. A pulmonologist. It's always helpful to maintain contact with your pulmonologist post-transplant. So if we need spirometry between visits or anything lung related, again, it'll be helpful for you to have a local doctor to keep an eye on that. Also, finally, other specialists. So we can always refer you to a specialist at Brigham and Women's, but if you want to do something closer to your home, you need to do that for cardiology, dermatology, nephrology, endocrinology, gastroenterologists, hematologists. It's a whole slew of specialties that you can make sure you have locally if you don't want to come to Boston. So with transplant, there's always a potential for complications. So I just want to kind of go over them quickly so that you're not surprised if they come up. Everybody's an individual, every case is unique, but these are some common ones that come up. So first, you could end up with a tracheostomy. This is something that goes in your neck to help you breathe. You could be either on a breathing machine long-term, or it helps us suction if you have multiple secretions. With a tracheostomy, if you're hooked up to a vent, you're not able to talk. When you're farther out, we do have a cap that can go on there to help you talk, but it is something that some of our patients see. Sometimes long-term, we can remove it after the fact, so it's not necessarily permanent. Same with feeding tubes. If you're unable to eat by mouth, it's important to keep up your nutrition, so you could get a feeding tube placed. All of the medications that you're on are toxic to your kidneys, so potential for kidney failure and need for long-term dialysis or kidney transplant. Diabetes is also common with the high-dose steroids and everything. You might need frequent glucose monitoring, and some even need insulin use. Blood clots are common post-op, so you might need anticoagulation or monitoring for that. Osteoporosis, again, weakened bones, put you at risk for bone breaks. And so, we strongly recommend following up with either endocrinology or your PCP for bone health. We recommend patients get DEXA scans and all of that to monitor that. Infections are common. You're on immunosuppressant medications, which puts you at risk for infection. So you want to keep precautions and stay away from sick people and follow up if you have any changes in symptoms, cough, fever, anything like that. Because if you have an infection, we need to treat it fast so it doesn't escalate. All the medications you're on for immunosuppressants also puts you at risk for cancers. And then there's always the risk of acute rejection, which is usually within the first year, or chronic rejection, which is farther out. Despite all these complications, there are successful lung transplants, and we have a recipe so that that can be you. Patients that do well with transplant openly communicate with the lung transplant team. So as we talked about, you call us, you inform us, or you send us gateway messages. You're open to communication. You're available when we call you. You are compliant with your care. So if we ask you to get repeat labs, you get repeat labs. If we ask you to adjust your dosing, you adjust your dosing. You come to clinic, you're prepared, you follow precautions. Also, staying active and eating healthy is important. Lungs work when you're moving around and when you're at an ideal body weight so that they can explant appropriately. So staying active and eating healthy is important. And lastly, having a positive and respectful attitude. So recipes for a successful lung transplant. Patients do well when they openly communicate with the lung transplant team. We want you to be in touch with us if there are any changes, and then we want you to answer and respond to us if we reach out to you with concerns. Also, if you're compliant with care, so you have to take your medications as directed. You have to get lab work done if we ask you to get repeat lab work done. You have to come to your appointments so that we can get chest x-rays and spiro to get the testing done. And then you need to follow transplant precautions. So staying away from sick people, not lifting a certain way with your sternal precautions post-op, things like that. Staying active and healthy is also very important. Having a healthy body weight allows your lungs to expand appropriately. Staying active exercises those lungs and keeps them healthy. And lastly, having a positive and respectful attitude. So we are all one team. We're here to help you, and we all need to treat each other with respect. It's hard work to have a transplant, so you need to be flexible and take the good with the bad, understand that it's a process, and be active, present, and in charge of your care. You have to really know what's going on and take action and be an active participant. So good luck with your transplant. We're here to help.